Thanks, Roy. It's my great pleasure to have the opportunity to share with you our latest projects that we did in Chinese University. I'm Paula Hodgson, actually work very closely with teaching faculties who use technology. And this one, as you can imagine, what is immersive formative assessment? Can you have a guess? Was it related with technology? Virtual reality, yeah, something like that. Right, I would like to, before I start, you see the lengthy list of people there, because anything with VR requires a team to work together, because it's no single person's effort that can make this happen. Now, the faculty member, Professor Vivian Lee, she is a professional pharmacist, but also teach in Chinese U. So she has to prepare our future pharmacists so that they can practice in the hospital, if not in the healthcare center. Now you can see this is typical classical university setting. That is, they simulate what the real world is like: hectic, busy, chaotic. Whereas in a simulated clinic, it's quiet, simple, and focused. So that's exactly the challenge for faculty or the teachers to teach. They want to present the skills and also the knowledge, but at the same time, they are really preparing them to work in the real world. Okay? So that's the challenge the teachers have. And when the pharmacists, I don't know how many of you have a chance talking to pharmacists before? Anyone? Have you got sick before? I'm sure you do. You might go to the chemist to get a Panadol. But normally, if you have more serious problem, you need to go and see a doctor. But you may not, in Hong Kong, have a chance to talk to a pharmacist, which is a bit unusual when you're in Europe, if not in North America, because the pharmacists play an active role with patients. So this is a typical, they call a medical record of a patient in a written format, and pharmacists kind of often given that is the case about a patient. And the next thing is they need to find out how to interpret. Don't worry, I'm not testing your eyesight. You don't read the script. It's only those professionals know how to decontextualize all these acronyms, like DM. What is DM? That is a Tong Liu Ban, right? Or many things on the script they understand, but not as a layman. So students have to prepare to read this kind of transcript and then think about, okay, what the patient's conditions are like, how is going to prescribe the right medication for such a patient. And for teachers, this is Professor Lee. She's the one who teaches in the ward. And often from time to time when students have to practice in the actual real world, she can have the interaction with her student, demonstrating the skill set, so on and so forth. But very often, when students really start their internship, they lack confidence. And they just feel nervous, and because they really don't have much experience, which we all understand. And very often in the university, they base on the paper case, like what I just showed you early on. That is, they have to look at the paper case, and then as they have to start internship, there is very limited conversation directly with the professor. Mind you, she has 50 pharmacist students, not 2. So that's a challenge for the faculty. And so thinking about preparing our students or our pharmacists, that's the reality, that the limitation we had. So we maximize the possibility to use alternative solution to help them to visualize what the real world is like, what they need to do in order to perform in the real world. So when we create this project with the faculty members, we have a clear mindset what we want to get. It's not, oh, let's do something fancy, nice looking. No, there are clear objectives because they are preparing year 3 pharmacists. They're going to go to the intern in year 4, and they really need to know not just what's the symbols, what the drugs, dosage. There is an integration happening in the real world. That is, apart from the drugs they prescribe, there are people they interact with. So in order to prepare a safe environment, that is, they can test and trial and interact and communicate with simulated patient, then they can rehearse what kind of question when they see a patient, if not with a doctor. So that's the clear expectation for the project. I'm not going to give you in details when we create this product because there's a series of things happening before it actually happening in the classroom. But other than defining how many cases we are going to support the teachers to build, and at the same time, what are the main concepts that the students should go through as they go through the virtual world, and there are more technical things happening. So I'm going to elaborate a little bit, and then I'll talk about the feedback part. So when you say a storyboard, what is a storyboard? Well, is it just like a description like what we just saw? No. When there is a story that is about the patient's condition and so on and so forth, and there might be questions we want the students to respond to, we describe it in a word format, and then afterwards, they need to think about if we create like a movie, a series of stories, okay, where is the patient, what happened, how many characters there are. We're using real people, not animated case. And then what action or things they need to have, like a clipboard or the medical history things, they need to prepare around the place. So they need to create, this is called a storyboard, describing the sequence, but also the situation, the angle, the resources required in order to film it. So the we've got a team, 2 technical staff to really go and do the filming. And the patients and the doctors or physiotherapists, they are actors. Okay, of course, they can't really go to the real world to do the real world filming. We are still based on the simulated world, but create a scenario. And so they have taken a variety of shots before they choose which is the best one to be used in the classroom. Before they really try it out, there are a lot more preparation. We are doing a pilot with her students to try what it feels like if they are given the scenario. We use Google Box. We also have, we call the HTC, that is a head-mount display. I point the pointers there because it's not just students who come to do the pilot with us. It's the faculty member, the teachers. She has to know what it's meant when she sends the students go to see the virtual world, you know. She knows exactly what it feels like, what it meant to be when student goes through the motion. So she joined us in the pilot. And before we go to the classroom, there are different sessions at different locations. And we have built up 2 cases. We need to know which case to be used and what equipment to bring to the classroom. Remember, we got the HTC with the sensor, but also we need to bring the Google Cardboards to the classroom because they are at different locations to be used for the students. So we have to have a laundry list to prepare before that. And then, not into the classroom yet. Students have to be given clear instruction. They don't just go to the class. Before they come to the class, they were given a clear instruction, what do they need to have with their phone, what kind of software they need to download before they come to the class. So they can't just come to the class. And there's also another instruction given by how to use the sensor, what to do with the controller. So all this preparation need to be done. Instructions to the students. Here comes the class time. In the class time, you can see one of the students kind of wearing that. It's not a faculty member because the teachers have to teach. So one of the students literally putting the head-mounted display and with the sensor to go through the video together in the classroom. And the teachers kind of walk through with the students in the class, and you can't see the teacher is here. we have to dim the classroom a little bit in order to see what's in the front. So in the front, we also have a display like now with a front projector, and this student walks through the video together with the class. And you see these are real doctors there, or I mean actors. And then in the classroom, you can see students are working diligently. Teachers actually here, sorry, it's not clear enough, but the teacher's there, and students can also watch the front screen. They focus on what's being seen from the students in the front to go through the story together. It's not just about story. In the classroom, do you just want to watch a movie like this? No. Literally, each story is not just a display of information, if not a storyline. There are a number of questions built in within the story, and at the same time, sorry, that's the hand of the professor. As she goes through the situation, the scenario, she asks more questions. You know, this is not about multiple choice, it's not about finding me a right answer. Being a pharmacy student, you got so many things you need to consider in order to make a choice. So we don't use multiple choice as a solution. It's pretty much question built in, question in the class time. So you can have feelings. That's how it happened in the class. Oops, sorry, I pressed the wrong button. So what's the first experience? We got two cases, remember? If you were the students, you see what it's like in the classroom. Do you like it? If you were the student? Kind of. Okay. Exactly. In the first time when they tried the first case, it's kind of, wow, so much they have to look at. The scenario unfold, there are many questions they need to address, and they find it hard what to do, how to answer. They were shocked. They're not well prepared for this kind of learning context. So they suggest the professor, hey, can we have this information beforehand? That is, before they go to the case, can we know what kind of question will be asked in the class so that they are prepared? And surely, as we go to the second case, different story, different questions, and we give the teachers give them a lot of information beforehand, and they, during the class, were formed into groups to do the discussion. And that's the perfect time for the professor to provide feedback. When we talk about learning, it's not about seeing, challenging, but how to give feedback to the student, a just-in-time feedback. So after the students form in groups, looking at the second case, the teachers go around and provide feedback with the students in the immersive learning environment. And what happened? After class, you can imagine, students are so engaged, they come up with more class, and the teachers right in the center, okay? So, feedback to the students, here are some, just a couple of, I just take out some of, we did a focus group interview afterwards, and students kind of reinforce us that this experience is worthwhile, and at the same time, they see there is limitation, that what they have in the past is a PowerPoint, lectures, but that's not good enough. So we also did so with the students. We got 34 in the class. First we asked, do you ever have any experience with talking to a doctor? Or, sorry, this is talking to a doctor? None of them. How about talking to a patient? Most of them. They don't have an experience talking to a patient. So those are our pharmacists. So what we go through is how they feel about using this kind of virtual experience, our virtual learning processes to help them to learn. Seems as if mostly are quite positive. Now if you see there are some red, sorry, this one is agree, okay? Strongly agree, fairly agree. Neutral, but there are some students a little bit concerned about the experience because this is their first time. And so on and so forth. How did they feel about working in a clinic? Do they understand what it's meant to work in a clinic? Well, it seems as if they found that they know a lot more through the experience. And is there any chance they have to observe the patient? Observe. That is not just talking to the patient, sensing how he or she feels, looking at the skin, feeling about the breath, So all this can go through the virtual environment. And remember, we asked whether they have talked to a doctor before. Most of them haven't. So after that, they think they have gone better in terms of how to communicate with the doctor. And surely these are the more positive side that we can get through about the student going through the very short bursts of cases, but they mostly have very positive response to us. As I'm watching the time, so I'm kind of getting through the almost close to our end, and that is generally, there are majority of students pretty on the positive side, but don't forget, this is really their first time experience about sort of VR. There are some concern. Nevertheless, students inform us that they can certainly look at the patient from a different angle. It's much better than a piece of paper. And lastly, when I conclude, when we bring virtual reality to the class, it means we are better prepared students for the internship. Prepare them in the mindset, but also a holistic skill set that they need to have. And most importantly, is the in-class formative feedback, because we don't want to give students say, yet more multiple choice, give me an answer. No, that's not the way how they should learn. So in the whole process, we embed the real world scenario. The students will inform us this is certainly a better learning experience for them. So this is the end of my presentation. Thank you very much. Thank you.
Thanks, Paula, for the presentation. We still have 3 minutes for the Q&A session. Is there any question from the floor you would like to raise your point?
Yes?
The VR experience, is it film it in a 360 camera?
Yes.
And I want to ask, if you are using the VR, is it just like a movie to show them the atmosphere around, or is there any interaction in between?
Well, because I cannot show you the processes, and yes, when we use real patients, and the students can go around and see around the ward, and also the equipment around. So there are tasks they need to go through, like looking at this history, medical history, and there are some settings that literally the doctor was facing them. The doctor asked them questions, and they have to respond. Okay?
That means they respond in between the movie.
Yes, they're asked about those questions. And that's why we do not record all the things, because we do not record the response from the students. We record the question raised by the doctor, the response raised by the patient. So, or the question raised by the, patients like to ask questions. Oh, does it work? How would I feel if I take the drug? So we put those questions in the video. And they can feel the patient's voice. They can see the doctor eye to eye when they're putting the goggles on.
And one more question. For the students, for the whole class, you just pick someone to experience this, and the other people just observe it?
When we do the answer question, we have both settings. In a sense, we bought the HTC, that is the head-mount display, and students were provided with goggles. I mean, we bought with the goggle box, and they can use their mobile phone to watch it themselves. But we can't do it in parallel. That is, you can't have one working and the other just put the goggle on. They were lost, because once you got the goggle on, you couldn't see anything else. So we divide the time. First, they go through some part with just the HTC, watching like the front screen, like the cap screen that I show you. But in the second case, students already have access to the second case. They got their mobile phone, and we bring the Google Goggle box, and they can preview it in the small group. So it's not just looking at the front screen. So we have different settings. We do it differently from case 1 and case 2. But if everybody just watch the front screen, it's a little bit pointless. Secondly, students can download the video and they can watch it again and again. And some students do told us that they do go back to the video and watch it afterwards. So they can watch it with their mobile phone afterwards.